Hello, everyone. I am Dr. Antonella Garbaccia, and for today's podcast, we have a special guest of honor, Dr. Andrea Master.
Thank you for having me today.
Welcome to our podcast. To introduce you to our patients and everyone listening, Dr. Master is proud to be providing in Southern California. He's a dental anesthesiologist, and your radius covers approximately 100 to 200 miles.
Yep, all of Southern California.
And you're born and raised here, right?
Yep,
Yeah.
absolutely.
And what's special about Dr. Master is he graduated from University of California, Irvine, and he has a Bachelor of Science degree in biomedical science.
Biomedical engineering, yeah, somehow.
Biomedical engineering, wonderful. And he was attracted to go back to dental school, so he graduated from Loma Linda University, right? And attended the anesthesiology program. He's dual board certified.
Yep.
By the American Dental Board of Anesthesiology and by the National Dental Board of Anesthesiology. Congratulations.
Thank you so much.
Yeah.
Thank you.
Welcome to our podcast.
Thank you again for having me. Thank you.
So today we're going to discuss about most common questions, going to bring up concerns, indications, contraindications for our patients interested to learn a little bit more about general anesthesia, different types of sedations. What are we providing during the journey of taking a patient throughout their treatment? So I will be, I prepared a couple of questions I will be discussing.
Perfect. Let's do this. Yeah.
This topic today. So the first question will be, how you determine if patient is a good candidate for general anesthesia?
That's a wonderful question. So our main goal whenever we see a patient in an office is always safety. In order to see a patient safely, we do so much work ahead of the day of treatment, and that all goes in the medical history. So we get a really detailed medical history from the medications to the allergies to the kind of doctors that they see, kind of procedures that they've had. We go through everything with the patient. The more information we have, the better. What makes a patient good candidate is how healthy they are. A very easy way to determine that is that if they can walk up a flight of stairs, usually they're healthy enough to undergo anesthesia in an office. The two main systems that we look at are the heart and the lungs. So if they have severe heart issues or they have severe respiratory problems, breathing issues, those are the two big issues that would prevent us from seeing a patient safely. And again, the goal is always safety. We would love to see every patient in an office, but unfortunately, we're not able to.
Yes, absolutely. Yeah, safety is the primary goal. Yeah. And what are the most common types of anesthesia that you offer?
Perfect. Yeah. So anesthesia has a wide variety, right? It starts from local anesthesia, which every dentist gives in every dental office, to nitrous oxide, the laughing gas that you'll see on kids a lot, to oral sedation. Dentists can prescribe a pill.
The most common is triazolam,
Valium, there are a bunch. Sometimes they'll mix. And then we can do IV sedation and general anesthesia. Every single one has its pros and cons. For instance, nitrous oxide is great, works really fast. It's on and off great. It takes the edge off, but patients are still aware of everything that goes on. The great thing is you don't need a ride. You don't need transportation. You can drive yourself home after, 5-10 minutes in the office. Yeah, absolutely. Oral sedation works great for a lot of doctors. There are lots of courses people take. The dentists can do it themselves after a course. The pros and cons. The pro is that it's easy to do. You don't need a special person to come in to administer it. The cons it's hard to dose sometimes. So patients take one pill. It has strong effect, not enough effect. And then you have to take another pill. And how long does it last? So it's really hard to time. Patients do need transportation for oral sedation. They can't drive themselves home.
Yeah.
So then we go into IV sedation. IV sedation has mild, moderate, and deep sedation. A lot of times when we talk about IV sedation, it's what people get when they're getting their wisdom teeth out or undergoing colonoscopy. Usually those procedures are really quick, 20, 30 minutes. You get an IV, you need transportation. Patients most of the time don't remember anything. They can, however, a lot of patients have told me that during their wisdom tooth extraction, they kind of woke up in the middle, they got more medication, they went back to sleep. For general anesthesia, which is a lot of what we do.
What we do as well.
Yeah, absolutely.
Very comfortable for a patient.
Yeah, patients are completely asleep.
A couple of hours.
Yeah. So I put patients under general anesthesia for 30, 45 minutes up to 6 to 8 hours. Patients don't remember anything. They're completely non-responsive to any pain or stimulus. We provide a safe airway to make sure that they're breathing safely and comfortably the whole time, which is very important, especially because we're working in the mouth. We're doing a lot of, dentistry, water, particles, sometimes bleeding. So we want to make sure patients are breathing safely and comfortably. So general anesthesia allows us to do that.
Yeah, I do recommend general anesthesia to our patients. It's completely safe from any aspirations, any fluids, blood, saline irrigation, any type of particles. It's just definitely the best way to go when a long procedure, surgical or prosthetic procedure has to take from 2 hours to 5 6 hours.
Absolutely. And what we actually do versus the hospitals do lots of breathing tubes through the mouth. Of course, we don't do that. We have to go through the nose to leave the mouth open to provide great dentistry.
Yeah. We feel very comfortable working with you and your team. And it's providing a good access, and then we are very efficient. We don't have to worry at all about suctioning, about fluids being around, our way and in your way as well. Yeah.
And with that being said, we still provide a throat screen to make sure none of those particles, no fluid, anything gets down there. I mean, we're obviously very vigilant. So, I mean, it takes a good team working with you.
Yeah.
But that's what we do. Like we said, safety is our number one concern. So we take every precaution possible.
Mm-hmm. What will be your advice for our patients? How should they prepare for a lengthy procedure under general anesthesia?
Oh, that's a great question. So they start preparing from the very first interaction with us. So if they're even interested, then we like to give them a phone call and kind of go over their expectations.
You will answer their questions.
Absolutely. So we have everything written that we can send them, that we do send them, and then we also go over everything verbally and they have access to us every day up until the procedure and after the procedure as well. So when it goes to preparing for the procedure, the very first thing is knowing their medical history again, knowing their medications, getting us that information.
Thoroughly knowing every single medication they're taking and all the conditions that they're undergoing treatment for, making sure that the whole procedure is safe.
Yeah, the more information we know, the better. So we might
be an interview then.
Yeah, absolutely. So we go through the medical history with them. We might modify some of their medications. We might consult with their physician if they need to stop any medications before. And then we'll go through kind of what to expect as we get closer, when to stop eating, which is super important. A lot of people will say, oh, it's just a dental procedure. I had breakfast in the morning. However, that makes it very dangerous when they eat. So we tell them very clearly when to stop eating, when to stop drinking, what medications to take, what to bring to their appointment, that they'll need transportation. We always kind of recommend a blanket just to keep them warm during the procedure, comfortable clothes, remove any watch, empty their pockets. So we go through every possible detail with them. We don't leave anything up to chance, removing contact lenses, things like that. So we go through everything with them. And of course, it'll also depend on when their appointment is made. So for instance, if their appointment is, let's say 1 month out, we'll go through everything with them when they make the appointment. And they'll get another call, 1 to 2 days before the appointment, just reminding them of everything. And they'll have everything in writing as well. And we'll go through everything as well verbally. And they have access to us if they have any questions at all.
Mm-hmm. And preferably it's a morning appointment, right?
Yeah, absolutely.
But you can also do an afternoon appointment, knowing that still the preparation has to be really respected in all aspects.
Absolutely, yeah. We require a lot of trust in our patients. That they follow all the instructions, and we'll confirm it day of to make sure that every single step was taken.
Do any known allergy or sensitivities have implications for the anesthesia process from the patient perspective? We have a lot of our patients having sensitivities to medications throughout their medical history. We find a lot of red flags, sensitivities, allergies, or known true allergies like penicillin allergy.
Yeah, absolutely. So again, that's where the medical history and going through everything is so important. So I've had so many patients say, you know what, this one medication, it doesn't work well with me, or it sedates me for too long, things like that. No problem. We'll find a cocktail that works. And cocktail, we mean a mix of different medications. We'll tailor everything to that specific patient. Patients are always worried about having a reaction to anesthesia. patients have a higher chance of having a reaction to an antibiotic that's prescribed to them at home than they do having a reaction under anesthesia. The medications we use have a very low chance of any reactivity. But with that being said, of course, we're monitoring them for any kind of possible reaction throughout the procedure, their blood pressure, their heart rate, everything.
Is unmonitored, and you have a very thorough log. I saw your notes are coming in very, very, very thorough. Every couple of minutes, entering all the values. Yeah.
Absolutely. So if there's any problem, of course, we're there. That's what we're there for, and that's what we're trying to do. But with that being said, it's kind of like a contractor. Yeah.
It's more important. It's more detailed, and then prepare more and do less.
Absolutely. Right? Yeah. We always kind of prepare for the worst, but are kind of hoping for the best. So I mean, even they'll see us on the day of treatment. We have any kind of emergency medication or equipment that we could possibly need, but we never use them. But they're there just in case.
Mm-hmm. And what would be the difference? I often have my patients ask me, what is the difference between a dental anesthesiologist and a medical anesthesiologist?
Yep,
and how would be the interaction in a dental office? What would you recommend the best choice?
Yeah, another great question. So we actually train with, so just to backtrack, a dental anesthesiologist went to dental school and then went through a dental anesthesia residency. Medical anesthesiologist, of course, instead of dental school, went to medical school and then did a medical anesthesia residency. However, we did a lot of the same cases during residency, during our training. And I worked with a lot of great medical anesthesiologists and medical residents. Main difference is medical anesthesia training covers things that we don't need in the dental office. For instance, they do open heart surgeries. They do, OB anesthesia, epidurals, things like that, things that we don't learn because they don't really translate or apply to our dental procedures, or, neonates, newborns, things like that, of course. So, of course, medical anesthesiologists are wonderful at what they do, but what they do is usually limited to a surgery center or a hospital.
There's a procedure, it's in the hospital or in a special care center. Yeah.
Absolutely. And they're used to having that auxiliary staff that there's a problem, patients, needs extra attention. They press a button and they have a flood of nurses and other physicians and people there to help. In a dental office, we don't have that. So that's why we talk about so much about preparing, going through medical history and choosing our patients wisely and setting ourselves up for success. So in a dental office, that's what we do. So
just walk us through a dental procedure, anesthesia procedure, step by step.
Perfect.
In the door?
Yeah, so the second they walk through the door, they'll be greeted by the anesthesiologist. And then we'll go over everything that we've already talked about. We'll go over the medications that we said we'd modify for them last time they ate or drank. Again, see if they have any questions. I know nerves kind of get the better of us, especially.
But they usually are pretty well, prepared.
Yeah, absolutely. And again, even we'll get a lot of questions the day before, the night before, and absolutely that's what we're there for. So we'll recommend that they use the restroom. So we'll have them go into the restroom, and then we'll take them into the dental chair. We'll put on some monitors. We'll do our physical exam, listen to their heart, go over any. Sometimes last minute questions come out at that point too. Yeah. And then we'll get all their vitals, make sure their blood pressure is where it's supposed to be, their oxygen saturation, all that good stuff. And then finally, the worst part of the day is what I tell my patients is we start an IV. So they get a little poke. And then that is what allows us to give them the medications that go to sleep. And regardless of how long the procedure is, they wake up and they're all done. So we're going to make sure that they're comfortable, their elbows and their knees and their back are all comfortable before they go to sleep, that their blanket is all tucked in, and then we give them the medication and then they go to sleep and then they don't know what happens after that.
Exactly.
And then as we kind of alluded to earlier, we place that breathing tube through their nose. So they might wake up with a sore throat. And then if they do, that'll be why. It's from that breathing tube that's keeping them safe and comfortable and making sure they're breathing comfortably throughout the whole procedure.
And I also saw that you're using some auxiliary devices to simulate the blood flow that's applied over the bottom part of the legs, right?
Absolutely.
Their extremities to simulate the blood circulation, blood flow.
Absolutely. In some patients that are older or procedures that are longer, we put compression devices around their lower extremities just to prevent any clots. Again, it's just an added safety measure that we take. We don't leave anything up to chance. We want to make sure that we're doing the best we can for our patients.
What would you say are the potential side effects and risks associated with anesthesia?
Yeah, so there's a wide spectrum of risks. We have common ones like nausea, vomiting, bruising from the IV, sore throat. All very minor. But those are our common ones.
Side effects, yeah.
The major side effects that everyone's scared of never waking up or having some catastrophe during the anesthesia, those thankfully are very rare. It's actually said in the anesthesia community that it's more dangerous, or you have a higher chance of driving your car to the appointment than actually having a complication during the procedure, because of all the safety measures that we take, because of all the advances in technology and biomedical monitoring. So again, we don't leave anything up to chance, in that we're making sure that we monitor the patient throughout the whole procedure.
That's wonderful. Yeah. Yes. Yeah, well, a couple of final questions. What will be the advice do you typically give your patients post-anesthesia care and recovery? That's the last one that maybe patient will want to know what's happening when they have to go home.
Yeah, absolutely. The best advice I can give patients after their procedure is just rest. Take as much time as you can, as many days as you possibly can, just rest. Especially some of these procedures can be long. They're having surgery, it can be quite involved sometimes. So patients want to get back into their normal life, get back into the normal routine, which is absolutely wonderful. But the longer they can rest, the better. So that'd be the number one thing. The number two thing is have everything you need after the procedure there before you go into the procedure. For instance, if the procedure dictates that you need to be on a soft food diet, have all that stuff before.
Majority of times,
absolutely.
After oral surgery,
have all
liquid diet, diet, everything should be prepared.
Everything should be prepared. Don't go shopping. Again, try to rest. Try to have everything prepared ahead of time.
Don't
give
it
a couple
go swimming or skiing.
Give it a couple of days. And of course, no driving. So that's why we have
we escort them to their car in the hands of their darling family, and hopefully everything goes as planned.
Yeah, absolutely.
Any common misconceptions about dental anesthesia they would like to address? Yeah,
the first one would be that it's very dangerous because we're in the dental.
It's a common misconception. Yes.
That we're in the dental office. Yeah. We're not in a hospital. Or
I can only do it once in a lifetime.
Yeah, absolutely.
And it's dangerous for the brain health.
Absolutely. Yeah. So we get so much of that because unfortunately there are providers out there that might not be practicing within their comfort zone. They're seeing patients they might not necessarily be comfortable doing, or doing procedures that they might not. So unfortunately, those are all the cases that make the headlines. And of course, the headlines are the only cases that patients know about. But of course, if you think about how many dental offices, how many patients are going under anesthesia every day, thankfully, the vast majority of all patients, everything goes very routinely, and that's what we want. So the very first misconception is that it's dangerous, and I would say that this is what our training is to make sure that it's as safe as possible, and if there's anything that's out of the ordinary, that's what we'll let inform the patients about.
The preliminary screening will let them know, and you can make a decision. You would recommend or not recommend a different type of anesthesia depending on their health condition.
Absolutely. Yeah. The second misconception is that, and we kind of touched about it on a little bit, is that medical anesthesiologist is much safer, has better training than a dental anesthesiologist. And again, nothing against medical anesthesiologists, are absolutely wonderful, but in the dental setting, this is what we're specialized for.
Dental office, not in a hospital setting.
Absolutely. And seeing these patients.
So you bring all the equipment that it's necessary, and we have all the technology and monitoring available on site. So
absolutely.
Absolutely.
So there's nothing a medical anesthesiologist will bring or can do that we can't do.
Unless the procedure has to happen in a hospital.
Of course. And actually what offices and patients don't know is that the Dental Board of California, actually, we go through a very rigorous process in order to get a GA permit as dentists. The medical anesthesiologists, even though they have a GA permit, don't go through anything nearly as rigorous. So the dental anesthesiologists are actually much better screened by the dental board than the medical anesthesiologists. So again, it's just one more safety measure to ensure that your dental anesthesiologist has the qualifications to make sure that they're seeing patients safely and predictably.
Yeah, what would be your recommendation on the interval between two procedures? Sometimes our patients undergo multiple phases, surgical procedures or full mouth preparations, and from surgery to restorative, that might be 2 or 3 sessions of general anesthesia. We have a lot of patients in need to really be relaxed and sleeping. Either there is anxiety or there is severe gagging reflex or any other long procedures that will need your help. What will be the shortest interval in between those phases that you would advise our patients to?
Sure, yeah. I mean, we, of course, this happens to us a lot. Patients have multiple phases, as you mentioned. So what we usually recommend is splitting those phases up every month. So at least a month in between.
At least 4 weeks in between.
Absolutely. Sometimes we do it longer depending on, if the phases need, healing after an implant or whatnot, but at the very minimum, 1 month.
Finally, what would be major complications? Is any major complications that the patient should be aware of?
Major complications, yeah. So like we said, major complications are very rare.
Very rare.
So it's not something to be worried about. Of course, if you are worried, we're happy to have that conversation. You have access to us from the second you're thinking about the procedure all the way until you're done having any questions. Even if you have a question for us a week after the procedure, we're here for you. You have access to text, phone call, email. We're here for if they have anything. But again, the major complications,
it's a pretty safe procedure.
The major complications, again, thankfully, are very rare, and that's what we spend. That's why we spend so much time.
Probably number one misconception, because it's truly not the situation we do have.
Yeah, absolutely. We spend so much time before the procedure, reducing any chance of major complication. As long as patients are truthful and following all the guidelines that we set for them, then we have a pretty routine procedure.
Thank you for answering most of the questions we had. Hopefully this information is wonderful and very helpful for our patients. And looking forward to have you. Actually, you're coming in tomorrow.
Yep, I'll be back.
For the surgery. I'll be back. Yeah. And sedation, thank you very much for being there for our patients, for everyone in the community.
No, thank you so much for having me. It's a pleasure working with great providers like yourself.
Thank you. Pleasure is ours. Thanks for watching. We'll see you next time.